The previous one.
Right. Our next conversation is commemorating what happens globally tomorrow. The 25th of April is World Malaria Day, and World Malaria Day is basically a day set aside by the World Health Organization, working with very many other partners to look at the fight against malaria. In the 60s, malaria was retreating until the world hit pause. Global eradication efforts were abandoned in 1969, and millions of lives were lost. It took 30 years for the world to fight back against the deadly disease. And the World Health Organization says, let's not let history repeat itself. And that's why the theme for this year is Malaria Ends With Us. Reinvest, reimagine, reignite. And therefore, we have re-invited, no, okay.
Technically.
We have re-invited Lizz Ntonjira to come back to the NTV studios. This time, not as a journalist and anchor, but as a co-chair of the Zero Malaria Campaign. Zero Malaria Campaign Coalition. Good morning, Liz.
Good morning. How are you, Latif? I'm fine, thank you.
Good, thanks. Good to see you.
Hi, good to see you.
Nice to see you.
I heard her back there saying, these lights.
Yes.
So, were you getting
I did not
memories?
miss them at all. Flashbacks.
Just being blinded.
Yeah.
And then you get used to it, you get numb. But if you take a break, kidogo, you're like, wow.
What is this?
Yeah.
Yes, a lot.
For how many years were you here, Liz?
Cumulatively, I think I was maybe 4 or 5 years. Yes.
Okay.
But in the media world, I think close to 10 years. Yes.
That's camera 3. That's your camera. That's the other piece. Go.
Ati, go. Give us a global intro. Go.
So funny.
Jackso ameniambia, you don't have the earpiece. Jackso is telling me that's your camera. So go ahead. Say hello to everybody.
Hi, everyone. Nice to be here and very happy to talk about something that is very beatable. But every year we keep having the same conversations about how we really fight off and eliminate malaria. Yes.
Yeah.
Getting into that conversation right in segueing with today's quote. Yeah.
Today's quote, in fact, I'm curious, I'll have a follow-up question for Liz, but this is Toni Morrison. She was an author, an activist, somebody who many say really highlighted the Black female experience from an African-American perspective. And she said, if there's a book that you want to read, but it hasn't been written yet, then you must write it. And now saying Liz already wrote a book called Youth Can. Is there another book in you, do you think?
Who knows? Yes. Maybe it's coming.
But you wrote it because you were like, if I haven't seen this book, so
Yes.
I would rather write it. That was one of the reasons you did it, right?
Yeah, that was the reason I did it. And because for a long time, we've not had the youth voice. We hear it, but we let it be muffled by other conceding or other larger voices. So it's really important to just have the diversity of perspectives, diversity of ideas, and just letting people know that influence doesn't start with 10 million followers or the wealth that you have attached to you. It's all about your purpose. What is your mission? What is that you really want to leave this world with? Yes.
Oh, that's good.
That's a big and powerful one. Liz, you know, malaria means different things to different people in Kenya. There are people who come from regions where the word malaria means a serious sickness and death.
Yeah.
There are people from other parts of the country where malaria ni malaria, unakunywa dawa, unapona. Okay? Why is malaria big in Kenya?
Malaria is really big in Kenya and even globally just because of its impact. And we won't even get to the economic impact. Let's just start with the health impact itself. We released, just previously, I consulted for the UN as the Global Communications and External Engagement Advisor for the RBM Partnership to End Malaria, which is an organization that brings together all the partners, over 500 partners working to end malaria. And WHO, working together with WHO, released the 2024 Global World Malaria Report in December last year. And 263 million cases with close to 600,000 deaths. And guess what? 90% of that high burden is in sub-Saharan Africa, with 52% being 5 African countries. Now in Kenya, it's a big issue because I think when we just start talking about the symptoms, we tend to really, I think malaria has been viewed as something that everybody gets, so it's not really a big deal. But I think when we start thinking about how it impacts our GDP, For instance, just recently there was a study done to just showcase how malaria impacts the economies of different countries, especially the high burden, high impact endemic countries. And Kenya, in Kenya, the results showed it affects our GDP per capita by 0.7% annually. That's a huge one. And you have to compete with markets and countries that don't have malaria. So this is why it's important. It's important because it talks about our workforce productivity. It talks about the caregiving needs. It talks about how malaria disproportionately affects and impacts women, particularly pregnant women and children under 5. I don't know, we've been here for maybe, I mean, we shouldn't be losing a child every minute to malaria. And I know sometimes when we talk about the statistics, people become a bit numb, but then when there are stories, what you are alluding to about the stories, you need to tell them. When we have the faces of the children, the people that are really being impacted, I think it drums down to the people to act.
Yeah, I want to come back at some point to the Zero Malaria Campaign Coalition and just find out about it, who are the member organizations and all. But there's some statistics here, or rather something that I want to compare to. Kenya reduced child mortality due to malaria from 8% in 2016 to 6% in 2020. But are we on track? This is a big question. Maybe I'm even answering myself. To eliminate malaria by 2030. We hear all these milestones, eliminate by 2030. Are we on track, would you say?
I don't think we are on track given the statistics, given the World Malaria Report 2024, given the report itself within Kenya. And this is because of what within the health malaria ecosystem, the different partners that we work with, there's something that we're calling the perfect storm, which is the reducing or dwindling funding across health and malaria, to be specific, the exacerbation of climate change, the increased populations, the displaced persons, biological threats like insecticide resistance. So all these things combined together, it's a perfect storm. I don't think we are on track. There's a lot we have to do, but there's still the kind of half glass people. So we have to look at it that way and be hopeful that something will be done. Yeah.
Sometimes we forget that whilst COVID was happening, other diseases were still existing. I think we got, very granular and very focused on fighting COVID, but I know other diseases suffered quite a bit in terms of whether it's funding or response during the COVID period, because all our resources were there. What did COVID do to the fight against malaria?
Oh, wow. It did a lot. I think not just to malaria, to HIV, to TB, to other non-communicable diseases, NTDs as well. I think there was a lot of focus, and like we all in journalism know, it's the media will tell you what to think about, not how to think. It's what to think about. And then it was just around COVID. So investment, funding, everything was really being channeled towards COVID, forgetting that there's been more impacts from malaria, and the death toll continues to rise. But that's not to say there's not been enough progress. We've seen countries like Cabo Verde, Egypt last year achieve malaria elimination, which is really great. Now their task is to maintain that momentum and not to have it reintroduced. We've seen also Georgia reach elimination. However, there's a lot of investments that has to go with it. And I think your previous guest talked about knowledge. Information is power. And malaria being really beatable and preventable is because of lack of information. And the lack of information is because of the channels, the formats, the language that is used, the campaigns that we roll out. They really need to be tailor-made and contextualized to the different endemic communities that we are working towards reducing the malaria cases. And this for me is really poignant, and I'll get to the ZMCC, the Zero Malaria Campaign Coalition, and why it exists, because we really need to think about, and what COVID brought to the fore was how we communicate. So what we say is just as important as how we communicate it to the different people that are being impacted. And one of the biggest things we saw during COVID was use sanitizer, wash your hands with running water, social distance. But that communication didn't really work in communities, rural areas and slum areas where, I mean, we live
It's
2 centimeters. It's
impossible.
impossible. And there was nothing, there was no communication until much later that talked about, oh, you don't have to use the N95 mask. You can use a shawl or something that is readily available to you. And that's the biggest missing point in health communication. Prevention is better than cure. We can prevent malaria. Yeah.
I'd like you to paint a picture of not just in those figures and numbers, but I'm sure you've interacted with people, you've gone into communities where malaria is rampant and where malaria is basically just causing. Tell us a story of malaria from a community perspective.
Yeah.
Like, in which parts of the country is malaria really like a direct killer? And how so?
Okay.
How does it manifest? How are families impacted?
Okay. So in Kenya, we have the endemic counties, about 11 of them, about 12 of them, lake basin counties, particularly where you have Trans Nzoia, Vihiga, Kisumu, among others. So the impact is, think about this, we were in a community where there was a lady who's pregnant, who had malaria. She couldn't be able to cater to her children, and at a really rural setting, you go fetch water, get the firewood, fend for the family, etc. And she was a single mom, and she wasn't really able to do this. And this is where I really saw the work that community health workers do, which we've changed their name to community health promoters, who we've continued to champion how they need to be recognized and remunerated within the health ecosystem. She was being supported by a community health promoter, who's a volunteer, by the way, and ties to the lack of funding, because a lot of these community health promoters were being given some kind of money, stipends from this USAID funds, etc. No, without that, this woman would have been by themselves. The high fevers, the lack of, community support, sometimes because of the lack of knowledge to understand that for a pregnant woman, the degree of the effects of the symptoms, etc., will be more exacerbated as opposed to just a normal person. Because of that lack of information, you assume Latif has, Janet has gotten, what's so different or unique
deal?
with you? It's not a big deal. I don't know if any of you has ever gotten malaria.
Yeah.
I have.
I'm the only
Look at me trying to think. I'm like, yes, I have.
And that's the situation. She can't fend or support her other 3 kids. She's pregnant. She needs to rely on other people for day-to-day basic needs. It's when you think about it, without that community support, without the drugs that really help and support, because the health facilities are also far, etc., it becomes such a huge issue.
I wanted to ask about insecticide resistance and what it's doing to the fight against malaria. Because even just speaking from my point of view, you can spray a mosquito and it stares right back at you. You're like, they're evolving.
It's
What's
like
happening?
bet.
Yeah.
You sound like you had a staring competition
Right,
with a mosquito.
Yeah. But I'm like, why are you not dying? What's happening?
Yeah.
It's had a lot of impact, but there's been a lot of R&D, research and development into this. I think one of the things that has also helped is the uptake of the vaccine. The first vaccine, malaria vaccine, was approved in 2021. The second one was approved in 2023. We're very lucky that Kenya was amongst the first countries. The pilot countries was Ghana, Kenya, and Malawi that were the pilot countries for the malaria vaccine. It has really helped with the efficacy, but then it's the constant communication, and that's why we really want to continue with the literacy levels around the communication on what you need to do and why this vaccine is important, because it's a number of sessions you have to go for. I think that has helped. There are different things that have complemented. I know that drug resistance is a big issue, but then we have now treated mosquito nets. We have the residual spraying that is also supporting. We have the youth, especially working with ALMA, which is they have youth cause across different countries, how we galvanize and bring together young people to support communities in clearing like bushes, stagnant water, covering water containers, making sure that this information really gets to the grassroots level. But yes, it has impacted.
Sorry, so there's multiple efforts. Talk a little bit about this vaccine. It's accessible to anyone, everyone, or what are the parameters? How can people access it? And you say there's several sessions. What does that look like?
Yes, it's accessible to, I might not speak to it as a doctor, medical doctor, just from a very comms and advocacy perspective. So it is available in the high endemic counties, the Lake Basin counties. There are different sessions, like the first one, then I think after it goes on till the baby is about 5 years old. It is accessible to everyone. I think the Ministry of Health has been doing such a brilliant job trying to really educate communities around the vaccine and making sure, especially pregnant mothers, and bringing men along, because we know the kind of typical cultural sometimes issues we have to deal with at the community level, making sure that everybody's informed on the benefits. It doesn't help we live in an age of a lot of misinformation and disinformation, and that's why really ZMCC exists, to be able to just share the accurate information to the right target audiences around malaria prevention, and also trying to make sure that people get the requisite information around the diagnosis, the treatment, the vaccine, and how they're able to get it.
Malaria is a public health issue, right?
Yeah.
And the way our health is structured, health is devolved. Policy and national programs are at the national level. At national level, we have the, what's it called? The
National
Malaria Control Program.
Yes.
So what is that? Is it a directorate? Is it an institution? What is it?
It is a directorate that works very closely with especially the counties on the malaria prevention, diagnosis, treatment, etc. I think there's been a lot of coordination efforts, and maybe your question kind of segues into what ZMCC is. It's a group of dynamic, diverse partners across the malaria ecosystem in Kenya that the National Malaria Program brought together to ensure that there's county representation as well because of the devolved element. So we have community-based organizations, faith-based organizations, development partners who really work in the rural setting and the county setting. We do have the government, that's the National Malaria Program, as well as the county representatives that are represented, who attend regular meetings, as well as the private sector. We need more private sector funding, especially now that, with the decreased funding that is happening. This year will be a really difficult year, to be very honest. It's the replenishment year for also Gavi and Global Fund. I don't know how much you know about the replenishments, but the Global Fund replenishment happens in every 3-year cycles. The Global Fund really supports a lot of county efforts in their malaria prevention, diagnosis, treatment efforts at the community level. There are different working groups and different working groups that work towards that with the different partners that we have. Yeah.
When you say replenishment, what does that mean? So
replenishment happens in 3-year cycles. The last Global Fund replenishment happened in 2022 and closed at a record-breaking, I think, 15.7 billion funds that they were US dollars they were able to raise. So it's really reaching out to the private sector, to government, especially from Global North, Global South. There are usually 2 cohorts from Global South. This year, for the 8th replenishment, it's South Africa. Global North is the UK, working really together to see how to raise funds. The target for this year is, for this 8th replenishment, is 18 billion USD, and the Gavi replenishment target is 9 billion to fund the next 5-year strategy for vaccines. So all this is really sort of like, just raising funds from different sort of countries, partners, and seeing how we can put this in a large pot and then redistribute it to the different countries.
I want to ask a question, and we'll see whether it sidesteps a bit out and in, but as we've been having this conversation, I remember malaria campaigns being so vibrant everywhere, right? I think years back, between 2000, 2015, I feel like they were everywhere. At least I witnessed it. And then being in the coast, there was a lot of awareness. A lot of awareness. So,
and coast is an endemic country.
It's an endemic country. Yes. So I remember how even as kids and going into our teens, we were very clear about how to protect ourselves. We had our nets. We had that repellent on the wall.
Yes.
So I'm like, okay, there's definitely a momentum that's dropped. And I think there's been things like funding fatigue, COVID disruptions, etc. What worries me is that you have these diseases that need a long-term solution, but the funding patterns are so erratic. And sometimes I'm like, but you understand that this is something that needs to be sustained. I feel like sometimes it's derailed by something sexier, hotter, like, let's fund like COVID. or let's fund something else. So it might be a big question, but how do we get into the thought and process and support of funding things long-term, despite what else might be happening around us, because this affects and kills people. And at that time, the numbers dropped. I mean, you can see the data, how many people were reached. How do we work around that? It's a bit of a sidestep from this conversation, but it's a bigger one on this consistent funding.
I think national governments across board, whether it's Kenya, Mozambique, Nigeria, particularly the endemic countries, need to invest more in their health, in their public health, and to stop over-reliance on external funding. The current, based on the different meetings we've had at ZMCC, and what we are aware is that the current shortfall is, to really implement the malaria strategy in Kenya requires 9 billion Kenya shillings. 60% of this funding is from external partners. This needs to change. So my hope is that tomorrow, when we're commemorating the World Malaria Day in Kwale County, is that there is going to be commitments from the county budgets and the national budget on how we're going to really invest more in the health, in public health.
Now that you pointed us into that hole, Janet, let me just go right down that rabbit hole.
Let's do it.
He heard it and said,
yes. He was like, yes, we need more funding for, yes, exactly.
Malaria and this entire funding conversation just for health has been a money-making venture for a long time. And I think the chickens are coming home to roost. Because if you look at how much money has been put into malaria, just specifically malaria, and you've said that we have that approach, prevention, and we have diagnosis and treatment, but prevention is big. And prevention is the things that you said that your association is doing, creating awareness among communities and just making communities aware that cut grass,
clear your bushes, cover your containers,
stagnant water, and so on and so forth. And then you have then the support that you will receive with free insecticide treated nets. Those are being given for free. You have the residual spraying that's being done for free. That's all coming from funding. How have communities become more resilient after all this money has been spent, especially from an awareness point? There are things of cover, open water spaces, drain water spaces, clear your bushes. How much have we moved that needle?
Yeah, we've moved the needle to an extent, but I think the challenge, and Janet is in comms, and you know how investments are crazy in communication, especially when we start with interpretation. Yeah. Interpreting all this information into local language that people are able to understand and articulate and resonates with them. Yes, we've been able to move the needle, but there's still a lot more to be done. What doesn't help is the fact that the people don't understand when it's, how do I put it? When, as a funder, when you see the nets that you're paying for are being used to fish, or are being used for gardens, you get really upset and kind of bolts you to say, you can do your own funding. But then there's a lack of understanding that those nets cannot actually be used because they're not treated, they're old nets, etc. So it's, I agree with you. We need to do a lot more as an African or as a Kenyan population to fund for our own health. But yes, there's something that Janet had previously mentioned, which was around the awareness creation that back in the day was really poignant. Everybody was aware. There were really great campaigns, but these campaigns cost money.
Yeah.
They really do cost a lot of money. And I'll give you an example during COVID. One of the most, because back then I was the Global Comms Director at AMREF, and we worked a lot around the prevention and all these mitigating things around COVID. And one of the things we realized is, when we communicate, we just communicate and assume that everybody will understand what you're saying in this one language. We don't break it down to the different languages that people can resonate with or understand. That's number one. You need trainers to be able to help these people understand what you're telling them, right? Two, you need all this information, education, communication materials, not just in English, Swahili. You need to have them interpreted to Doluo, to Kamba, to Meru, to whatever language that people are able to understand, right? On top of that, don't forget, I think one of the biggest gaps during COVID was persons with disability. Getting this material also interpreted into Braille, into something that persons with disability also will feel included in that communication. It costs a lot of money. So we cannot say we have
So where has
achieved.
the money been going? If we're talking about all these things, where has the money then been going? Because it's clear from a communication perspective and, the coordination from national level and from all the institutions concerned, even the funders themselves, is that we need to have communication that is impactful, communication in which the community takes up the communication and now carries on communication, that children are taught by the elders in their community on these matters. Not that you'll have a visitor who comes once a week or once a month and then they call us to the market for a meeting and then they distribute flyers, but that this communication sustains. Did this happen?
This has...
And then, if it did, why would you get to a point where if Eric's mom taught Eric, why would it be that Eric is not teaching?
Yeah, passing that along, passing the baton. I think
and why
it
is
happens,
it that in that local primary school and the local kindergarten, children are not growing up knowing that this is what we need to do. We need to just clear bushes because malaria. These are the exercises that we do in school. We know we come with slashes. We are clearing slashes because malaria. We are covering all these water drums.
The school campaigns,
malaria.
that's what you're alluding to.
Where did the money go?
I mean, the money also... First, let me clarify, ZMCC does not receive any money from any funder.
Not for you.
Yes.
It's the
ecosystem.
The global ecosystem on malaria and all the money that we've dedicated into malaria.
I think the reports, if you take a look and really scrutinize the WHO report on world malaria 2024, it really shows the progress and where a lot of the funding has gone into. Has it gone into the preventative, to the diagnosis, to the treatment, etc.? It really does give a graph, a comprehensive of this is what has been used here, etc. And even for the partners within the ecosystem, I think within their annual reports, they do share this information on how the money has been dispensed and to what extent it has had an impact. I think that information is there. I think the thing with health, it's not one of those things that you do and then since you've done it, it's going to be eradicated. It's something continuous. It happens in perpetuity, unfortunately. That's the unfortunate thing about health. And that's why I think a lot of private sector does not invest in health because of that same reason. Because fatigue. And it's like a mirage. So this year, the progress has been great. You move, it's like a mirage. You move again, it's again, because of those factors that you were talking about.
The fatigue and all.
The fatigue,
before you come in, Mariam,
etc.
I'm still in that rabbit hole.
Of funding, where did the money go?
That over time we got dependent on funding, such that we can't think beyond the funding.
Yeah.
Okay. That we've gotten so dependent on the funding that even the government is thinking, Sawa, who's giving us malaria? Let's look at how we can get the malaria mosquito nets. Who's giving us the insecticide to spray? Okay, let's look at that. Who's supporting our health communities? Okay, so we have this NGO that's working in this area. This NGO is on a 3-year funded program. After that, what happens? We became so dependent on this.
Very true.
Can we emancipate ourselves
for
from
sure
the funding slavery?
And that emancipation starts with, if I could go back to the theme of this year, Malaria Ends With Us, reignite, reinvest, reignite, reimagine. And under the pillar of reimagining, there's a component around innovation. What stops us from getting innovative around how can we manufacture these nets? Are we able to draw and coordinate across different ministries? When we talk about some of the things that are exacerbating malaria, being climate change, how can we work with the Ministry of Environment, for instance, on climate adaptation that considers malaria? You know, it's really reimagining and reigniting. How do we think of coordinating better? I think one of the things that ails us as a country is we don't coordinate. Sometimes I've seen partners, even in the malaria ecosystem, one is doing, and you're like, I thought this other one was also doing the same thing. And that's why ZMCC exists, to make sure that there are no silos. We're breaking the silos to make sure that if you are working on this endemic county, what else can we do to complement with the neighboring country? Because remember, mosquitoes don't know boundaries. Us guys have to get passports and get into a plane. They don't.
They're just cruising.
They just cruise to the next. So whatever actions that you're doing in, say, the Lake Basin, you have to replicate them with the bordering countries in Uganda. Is Uganda doing the same thing? Otherwise, it's not helping. So there's a lot of coordination that is needed at the country level and at the county level and at the boundary level.
Wow.
I'm glad when I see the possibilities of zero malaria and people even speaking to it. For example, Maina Katasi says Malindi town had eliminated mosquitoes almost by 2006. There was no malaria that year. We failed to scale the prevention to the rest of the country. And I think now that's what brought it back. But it does mean that it's a possibility. However, I was looking at Smallest Ever asking about vaccines. He says being among the countries chosen to pilot the malaria vaccine is not something we should be proud of. There are numerous issues and widespread mistrust regarding the vaccine and the companies producing it. So maybe just speak to that, but not from, because I don't want to give, anti-vax platforms, but we also live in an age of medical gaslighting, and we want to be fair to people's concerns, whenever they do bring them up.
Yeah, I think in the age of misinformation, disinformation, now it's going to get worse with AI, and where things look very true, but they're not, and they're false. I think we also need to educate ourselves across different things. We have relied on WHO for a number of things. So when a vaccine is put out, it's not just out of the blues. It's something that has been under clinical trials for a lengthened period of time, right? And has gone through the different ethical processes that it needs to go through before it is approved, right? So I think I would answer it to that extent. And just mention that this is not only happening in Africa, but in India as well. There's a vaccine for malaria that was approved in other countries that are endemic. And when you note the reason why sometimes it might seem, why is this vaccine only in Africa? Like I mentioned, 90% of the 263 million new cases is in Africa.
So that's what the priority should be. I think, I've just been trying to look for that name. Was it commercial malaria?
Yeah, commercial malaria. Yeah.
And I think sometimes what makes the most noise gets prioritized. And, somewhere along the way, because there was a coordination, there was noise and amplification in terms of adverts, coordination. So you've talked about ZMCC kind of trying to coordinate everyone. You've talked about tomorrow, the day being marked in Kwale. Can you speak to 1, 2, 3 goals that you have in the next 5 years that you're trying to pull together as a coalition?
Yeah. So as a coalition, we're trying to ensure there's better coordination. I know we've been really trying to do that, but that's one of the key priorities, better coordination, to disrupt the silos, to stop doing the same or duplicating efforts rather. That's one. 2 is resource mobilization. How are we going to encourage the government of Kenya, for instance, to put more money within public health and to ensure that there's more domestic resource mobilization? As Latif was saying, we need to stop heavily relying on external partners. Yeah. And it's, when somebody is used to giving you something, you don't prioritize it. But when that cord is cut, you will start thinking about it and start prioritizing. So one of the key goals as well is to start thinking of ways to really amplify and put the fuel on domestic resource mobilization at the county, community, and national level. The third thing is more education, more awareness around how we can prevent ourselves from malaria. I think when you look at HIV, TB, malaria, one of the things that within the malaria ecosystem we keep drumming up is it's such a preventable disease. Yeah. It's really, really preventable. And prevention is better than cure. How do you prevent? By having information. So making sure that this information is accessible to different people, especially in the endemic counties, is really important for us as a priority. Yeah. And the replenishment. How do we support the replenishment agenda for Global Fund, for Gavi? Because if they don't get enough replenishment, it dwindles down on us as well. Yeah.
How do we make... Sorry, Eric. Do you want to go ahead?
No, I just wanted to point out.
Eric is still on the budget. And where's the money?
I'm not on the budget, actually.
Where have you moved to?
It's acknowledging the work that local research has also done. Well, it's externally funded and a lot of support locally, but the Kenya Medical Research
KEMRI, yes,
was responsible for the vaccine of malaria, the research that was done at the various KEMRI labs and all, and the work that was done by KEMRI Research, as in just developing a malaria vaccine and other work that they do. So yes, there is the other aspect. How do we fund our research? Okay,
that's a very good question. How do we fund our research? I think when we're talking to funders love to see the quick results, the impact. When it comes to research takes lengthy periods of time, decades, and sometimes it could be successful, it could not be successful. And as an investor, they're thinking, do I put my money in something that I'm not able to see the results in 3, 5, or 10 years, or do I move to something that I can see immediate results? And it goes with everybody. You want to see immediate results. I think that's one of our other goals, to continue ensuring that there's more funding around our research. APHRC as well, the Africa Population Fund Research has been doing a lot as well. I think there's a lot more that is being done at the local perspective. Latif, I kid you not, let me use myself as an example. I'm so passionate about health communication, mostly because of COVID, so much so that my PhD is around the role and impact of advocacy and communication on the uptake of the malaria vaccine, for instance. And then we'll see the results of the mistrust, the misinformation, the disinformation. What are some of the things that prompt people to actually go for this vaccine? How do they reach this information? And I'm looking at Vihiga and Kisumu County, because one is an urban city, the other one is really rural. Is there an impact because of the access to information and communication? So there is a lot that is actually happening at the grassroots level, and including faith-based organizations who are often left out, because a lot of people believe what their pastors and priests tell them, so they need to be part of the conversation as well.
How do we rope in people who may not have faced the malaria burden much, but who still need to be part of that conversation? Because to them, it's not a rumor, but it's something you hear.
Malaria become a homa too. That's
undermined.
They can be allies. It's the same way when we're talking about supporting women at the workplace. We use men as allies. We need people who are in non-endemic counties to be allies. I'm sure they do have friends, relatives, etc., who live in endemic counties, or friends or other people that have experienced malaria, or even people who have lost people to malaria. So I think everybody has a role to play within that malaria elimination.
For our mortality rates, as far as children are concerned, especially when it comes to malaria, we've seen a slight decrease over time, but is there any way to make sure that that number goes down significantly, even as we work towards zero malaria, perhaps zero mortality for children suffering from malaria?
I think getting more attention to pregnant mothers will be really critical, and this will require a lot more attention to health promoters, community health promoters, because then they are within the communities, the surroundings. I know our health systems and health facilities are overburdened. So the fact that we have health promoters moving from one household to another, giving the information, doing rapid testing, and also being able to dispense some medication has been really helpful. And that's how we are able to one of the ways that we are able to mitigate the mortality rates, especially under 5.
Also, there's integration, right? So it's not just fighting malaria, it's and integrating maternal health. So how else are you integrating the fight against malaria?
So it has to be working with different ministries as well. There are, I think Ethiopia has done such a great job in ensuring that when they're talking about, there's this tree. I'm sorry, I forget the name of what. I know you know it. It grows, the one that used to make the poles. The electric poles back in the day. Now it's it really saps the water.
Eucalyptus.
Yes, thank you. Blonde moment. Completely forgot. Having like trees like those. Nimezeeka, sorry. Making sure that we have information and working with like the Ministry of Environment. Where do we have like these stagnant waters, etc.? Can we grow eucalyptus? Because eucalyptus help in sapping, and getting that water out. It's a really collective effort within the different ministries. When we talk about the Ministry of Agriculture, how do we ensure that we are working with them to have like resilient crops that really support with the nutrition of the mothers, making sure that then they don't become super susceptible to infections or the disease rates, etc. So all these different efforts will really go a long way in supporting the zero malaria fight.
That's a good point to highlight, that integration.
I think it lacks, and it's not just in Kenya, and it alludes to the point Latif was making, that everybody wants something within the funds, so you end up duplicating. So there's a lack of really good coordination within the ecosystem, whether it's at the country level, global level, regional level, because there've been meetings where we've had and somebody says, we were there just last week, and then there's somebody else coming in another. How do you coordinate better so that you also, when you're doing clinical trials, like for vaccines, you don't burden those communities, because they also get tired of people coming to draw things from them.
It's the money pigs. It's the money. Everybody wants to have their budget so they can do the same thing. Doing the coordination means that some of that money,
someone will miss out from it.
Will miss out from it, and that brings me back into the National Malaria Control Program. It should be coordinating, right? Everybody who is involved in the fight against malaria, the NMCP should have a vision into what they're doing. Does it?
It does, to a considerable extent. I think the first step of even coming up with the ZMCC, this coalition, was a huge step. Making sure that having this consistent meetings where everybody raises pertinent issues of what they're working on, and the ZMCC has, the private sector, the counties are represented, faith-based CBOs, CSOs, the youth are also represented. I'll give you an example of the coordination just for this World Malaria Day. We had a meeting, I think 2 weeks ago, and what happens in these meetings is we talk about where is the progress, where is it dragging, what are some of the events or efforts or programs that are happening, where does anybody need support, etc. What I found really unique, and for the very first time, for this Kwale County event, with the shortfalls that we were having on funding, on putting up this to mark the World Malaria Day, there was a budget that the NMCP came up with, right? This, they said the NMCP program will support, the county will support on this. So it began, who's gonna take up this? The End Malaria Council said, yes, we're going to take this up. Malaria No More UK said, we'll take this other up. Vestergaard said, we'll take this up. Vestergaard is a farmer. And this is how you coordinate so that everybody's not marking World Malaria Day. And then there's this collective effort where people are galvanizing, coming together, contributing towards it and supporting it.
I promise I'm not trying to put you out of a job, Liz. I'm just trying to figure out, how do we make malaria the government's problem squarely?
This is really supported. It's not even this. Everybody at ZMCC is on voluntary basis. So it's really them having come and put all the malaria partners together and said, if you work with, say, the Netherlands government to support the work that you're doing on malaria, and you work with the UK to support malaria programs in Kenya, all of you have to intersect with the Ministry of Health in one way or the other. So how can we all come together? So it's actually the NMCP that brought us all together.
I'm trying to make it the government's problem, such that if I go to a dispensary and ask for a net, or I require prenatal care, all of that is funded by the government of Kenya.
No, now it's going to definitely happen, Mariam, especially because of all the funding. I mean, we've seen what the US has done. I mean, it's left a huge funding gap for HIV, TB, malaria programs. We've seen after the US changed their funding models, we've seen other countries do the same, like follow suit. We have Switzerland that's cutting funding on some of the things. We have many other partners or countries that are cutting funding. So you have to wake up to the reality that the funds are dwindling. So all that corruption money has better use.
So they'll be forced to wake up, hopefully.
Yes.
Maybe they're like, there's other things, I know. And another thing, I know we're finishing, sorry, Lachif, I'll just bring it back to you. I think another problem I find with addressing a lot of these issues, whether it's gender norms learning, fighting malaria, is sometimes they want results tomorrow. And I think we're now going to have to inculcate and push back and say, no, you'll get your results in a decade. We'll give you short-term, results or milestones, but I think funding is pulled out because of that fatigue, and I think that correlation. But I understand now there's a lot of communities and countries pushing back and saying, I'd rather you don't even give me that funding because you want me to do a 2-year thing for something that takes 10 years.
I think we also, just to add on to that, we need to do better in monitoring, evaluating, learning, and impact. We don't do very well in that. So there are some really great programs, but we don't communicate or showcase or give proper case studies of what actually has happened. So you feel like you're doing zero work, in achieving zero malaria. But there's actually, we need to be better at monitoring, evaluating, showcasing some learnings and impact, and then replicating what has worked in one endemic county to another county, to other countries as well, because this has to be a collective effort. Remember, mosquitoes don't have passports. So
I'm gonna remember that.
As you apply for yours.
International citizens,
Health is devolved. Public health specifically should always be considered. That's what I believe. Should always be looked at from a devolution point, and then you can just look at national level from policy level and coordination level. And I don't think that's what's been happening because people at the top want to cool all the money. because people at the top want to deal with those start-stop programs so they can eat money, but the community at the bottom is not benefiting. That's just my view.
There are communities benefiting, Latif. There are communities benefiting. And maybe that goes to the point of monitoring, evaluation, impact, learning. I think all communities need to do better at this.
It is everybody at the top needs to know devolution is where programmatic impact will happen.
Yeah, absolutely.
Thank you, Liz, for joining us.
Thank you so much.
Lizz Ntonjira is the co-chair of the Zero Malaria Campaign Coalition. Tomorrow is World Malaria Day, and as we commemorate that day, then let's also ask ourselves, what are we doing to do better on malaria, okay? Auntie, we don't have your world today.
Yeah, we're told we don't have your
world.
world.
So what do we have?
What's happening
Whose
at 10
world do we
a.m.?
have?
Okay, we have an event coming up, some coverage coming
All right.
up. But it's not
so
your
we'll
world.
have some live coverage on NTV. Of course, Nation FM is going to continue with the daily programming. What comes at this point? Muziki bila jasho.
Muziki bila.
Wow. Oh,
Muziki
Manza.
bila jasho.
Manza.
Yeah.
That's how you define
No,
reggae.
just muziki bila interaction.
Oh, because it's
Bila
very
interaction.
smooth. And
Yeah,
It's muziki
it's actually,
bila
I think it's
interaction.
rumba that's usually mziki bila
Yeah, mziki
jasho,
bila
because
jasho.
people just move, you know.
It's just a bit of swaying
It's
here and
just a-
there. I love it.
Yeah.
As for us guys will be back tomorrow morning from 6 a.m. to 10 a.m. And the us guys here are not inclusive of Lizz Ntonjira. She will be marking World Malaria Day in Kwale. It's Eric Latif, Mariam Bishar, and Janet Bogwa. Have a lovely day. See you tomorrow.
Bye.